The real question we need to answer is this: what exactly is irritating your throat every single day? Hello, I'm DrZivana. Today, we are going to walk through the 5 most common reasons why adults over the age of 55 develop persistent throat mucus and chronic throat clearing. More importantly, I am going to show you how 2 or 3 of these distinct causes often stack on top of one another, creating a frustrating cycle that standard remedies fail to fix. Understanding the biology of mucus. Let's start with a foundational truth. Mucus itself is not your enemy. In fact, your body naturally produces it every single day to act as a protective shield for your respiratory tract. It traps dust, smoke, bacteria, and allergens before they can travel deeper into your lungs, while keeping your throat lining perfectly moist. The real trouble begins when your mucus becomes too thick, too sticky, or too slow to move. Inside your airways, you have millions of microscopic, hair-like structures called cilia. Their sole job is to sweep mucus along smoothly so it clears out without you ever noticing it. However, as we age, this natural clearance system can begin to slow down. Mucus sits in place longer, causing it to thicken much faster. If an underlying issue is constantly irritating the throat, your body responds by producing even more mucus to coat and protect the raw tissue. This is basic human biology. To solve it, we have to look for the triggers. Cause 1, silent reflux, LPR. This is undoubtedly one of the most frequently missed causes of chronic throat mucus in mature adults. Most people are familiar with classic acid reflux, which causes heartburn or a sour taste in the mouth. But silent reflux, medically known as laryngopharyngeal reflux, or LPR, is entirely different. It earns its name because it occurs without causing any traditional heartburn at all. Instead, microscopic droplets of stomach acid or digestive enzymes travel all the way up into the throat and the back of the nasal passages while you sleep. Because the tissue lining your throat is incredibly delicate, even a minute amount of acid exposure causes severe microscopic irritation. In a frantic effort to protect itself from being burned, your throat reacts immediately by producing a heavy, thick layer of mucus as a defensive blanket. Ask yourself these questions. Is your throat mucus significantly worse within the first hour of waking up? Do you find yourself clearing your throat far more often after lying flat on your back? Does your voice sound rough, raspy, or hoarse in the morning? Do spicy foods, rich fried foods, chocolate, or late-night dinners seem to flare it up? If you answered yes, silent reflux is highly likely playing a major role. Cause 2, quiet post-nasal drip and sinus inflammation. When most people hear the phrase sinus problem, they picture intense facial pain, a blocked nose, or a heavy head. But as we age, sinus inflammation can become much quieter and more subtle. You might be able to breathe through your nose completely normally, yet the hidden lining deep inside your sinuses remains chronically inflamed. This low-grade inflammation causes the sinuses to produce extra mucus. Because the front of your nasal passages is clear, this excess fluid quietly drips straight down the back of your throat all day long, acting as a constant tickle. Many adults immediately reach for over-the-counter antihistamines to fix this. However, these medications often end up drying out your bodily fluids completely. This turns what was a thin, manageable drip into an incredibly thick, sticky, and stubborn paste that becomes nearly impossible for your throat cilia to sweep away. Instead, a highly effective strategy recommended by specialists is a gentle, regular saline nasal rinse. A warm, sterile saline rinse physically washes away trapped irritants, thins out stubborn mucus, and reduces active swelling. Safety note: you must always use distilled, sterile, or previously boiled water, never plain tap water. Consistency: many adults require consistent daily use for 1 to 2 full weeks before the inflammation subsides enough to reveal a noticeable difference. Cause 3: medication-induced throat irritation. This particular cause catches a vast majority of adults completely by surprise. A variety of widely prescribed medications can directly induce a chronic cough, localized throat irritation, or a non-stop urge to clear the throat. A classic, well-documented example is a specific category of blood pressure medications known as ACE inhibitors. These prescriptions play a critical role in protecting your cardiovascular system, but in a notable percentage of patients, they cause an increase in a natural compound called bradykinin in the respiratory tract. This directly triggers a persistent dry throat tickle. The truly confusing part about this side effect is its delayed timeline. It often does not appear when you first start taking the pill. It can take weeks or even several months of daily use before the throat irritation suddenly develops. Important safety instruction. Managing high blood pressure is absolutely vital to safeguard your heart and brain. Never alter or stop taking any prescription medication on your own. Instead, note exactly when your throat clearing began in relation to any medication changes, and take that timeline directly to your physician or pharmacist to discuss alternative options safely. Cause 4. Chronic, mild dehydration. This cause seems almost too basic to mention, yet it remains one of the single biggest reasons why throat mucus transforms into a thick, sticky nightmare. Healthy, normal mucus is composed almost entirely of water. When your body is optimally hydrated, your mucus remains thin, slippery, and easy to clear away unconsciously. However, when your body is running low on water, your mucus loses its fluid content, quickly turning thick, immensely sticky, and highly resistant to movement. This issue becomes uniquely problematic once we cross the age of 55, because our internal thirst receptors naturally become far less sensitive. This means you might not feel thirsty, even when your body is actively craving fluids. To combat this, adopt the habit of shifting your fluid consumption to earlier in the day to avoid disrupting your sleep. Try starting your morning with a warm glass of pure water before you ever pour your first cup of coffee. Medical exception. If you have a medical history of heart failure, advanced kidney disease, or have been placed on a strict fluid limit by your specialist, always consult your physician to identify the exact fluid volume that is safe for your specific body. Cause 5. The gut-airway connection. It is easy to view our bodies as a collection of entirely separate parts, but your throat, your lungs, your stomach, and your lower digestive tract are deeply interconnected through your immune system and your gut microbiome. When the bacterial community deep within your digestive tract is beautifully balanced, it plays a massive role in regulating your body's overall inflammatory levels. However, when your gut microbiome becomes disrupted, your entire body can slide into a state of heightened reactivity and low-grade inflammation. Many individuals who suffer from chronic throat mucus are surprised to discover that their symptoms are actively fueled by a diet high in processed foods, refined sugars, or a personal history of frequent antibiotic use. A far superior long-term approach is to gently support your digestive system. Focus on incorporating more natural, soluble fiber from whole foods that your stomach easily tolerates, such as leafy vegetables, and consider adding small amounts of naturally fermented foods like plain, unsweetened yogurt or traditional kefir if your body handles dairy well. Crucial red flag symptoms. While a vast majority of chronic throat mucus is entirely benign and caused by the everyday lifestyle factors we just discussed, there are certain symptoms that require immediate professional medical evaluation. Please schedule a comprehensive evaluation with a specialist immediately if your throat mucus is ever accompanied by unexplained, sudden weight loss, visible blood when you spit or cough, true difficulty swallowing food or liquids where it feels physically blocked, a persistent, unexplained lump in your neck, a severely hoarse voice that fails to improve after 3 to 4 weeks. Listening to your body's early signals and making healthy choices, one small step at a time, can make all the difference in the world. Thank you for joining me today. Stay healthy, stay active, and I will see you in our next health guide.